Now let's welcome to the stage Jason Pyle. He's the CEO of BaseHealth. And BaseHealth is a population health management company, there you are, focused on finding the invisible patient. So kind of sort of maybe a cousin here to what Nigam and company are working on. The idea of again, identifying rising risk patients, specifically when groups like ACOs and others have these large populations that they're taking on, that they're going at risk for, but might not know as much about. So the special way that we're going to do this demo requires some audience interaction. So all of you have a card in front of you that looks something like this. And what we're going to request is that everyone in the audience actually begin by standing up. So go ahead. It's good for your health. And we're going to go from here. Don't worry, you won't have to stand the whole time. Jason's going to lead us through the demo of BaseHealth as we start to understand how invisible patients in a population become visible.
Thanks a lot. Thanks for helping me by standing up. What we're going to look at here is our platform running a real Medicare population of about 17,000 members from one of our customers in 2016. The first graph you see here is a prospective analytic on cost, which separates that entire membership into two groups, known risk and unknown risk. So what is known risk? You're the people with red cards. Known risk are patients who have previous diagnoses, serious medical conditions, have used a lot of healthcare in the past. It's a small number of people, but it's not hard to find you because I know you're sick. So if you have a red card, go ahead and sit down. But the other part of this graph is unknown risk. So what is unknown risk? Unknown risk are those members who have no significant medical history in the form of claims or diagnoses. However, they're at risk, at very high risk, of becoming sick in the following year. If you have a blue card, could you just please hold up your hand? Okay, so as you can see on this graph here, these are claims of people who had zero medical conditions the previous year and were looking into the future year. Most people who have zero claims in the previous year have none in the next year either. You're the ones with the green cards, you're healthy people, but look at this really long tail. A small percentage of people in that group will actually become very sick in the next year, and they are what we call invisible patients. They're really hard to pick out from the rest of the group. It's like seeing the hands that are up in this huge group of people who are otherwise healthy. So if you have a green card, please sit down. If your blue card, remains standing. So what you saw right there is what exactly BaseHealth does, right? If you're a physician looking out on this, you're trying to figure out who is unhealthy in my population, how can I get to them quickly? Thanks a lot for everybody standing up and sitting down, I appreciate it. So how do we find invisible patients? So we gather all the available data on each patient of the membership. This includes laboratory data, biometric data, social family history, even genetic data, and we process it through a unique dynamic learning model for each and every member of this patient. And it's based upon the entirety of the peer-reviewed literature, which associates all known risk factors with all known major diseases. And through that, we were able to pick out this very small group of invisible patients amongst a huge sea of otherwise healthy people. So what does this actually look like in a real population? Well, in this 17,000 members, you can see that a very, very small number of these people are going to be extremely high cost, okay? In fact, if I click here, it'll tell us how many. It'll say out of 17,000, there's 324 invisible patients that are going to be very high cost. And if you intervene specifically with these patients, you're going to generate an estimated ROI of about 4,000%. These are the invisible patients in this particular membership that need to be addressed immediately. So what happens if we don't do anything? So this is a good example. So this was a patient that we picked out on the 1st of January. The healthcare system didn't know what was going to happen. So 3 months later, this person had their first heart attack. She went on to have a series of heart attacks and other complications, including chronic renal failure. She ultimately developed congestive heart failure. This patient's health was utterly ruined, and the costs were staggering to the medical system. So this was an invisible patient that desperately needed to be seen. So that's what we do at BaseHealth. We identify invisible patients, we identify unknown risk, and we improve the health and manage those members and improve the cost structure of that organization as we do it. Thanks for helping me, everybody. I really appreciate it. Hope we had a positive impact on everyone's health out here by getting to do a little exercise after lunch. If you want any more information about us, please take a look at the back of your card. Thank you.
Thank you. Come on, join us over on the couch. So thank you for showing us sort of your approach to sort of identifying patients. What are the types of data and processes that make your model richer and more accurate as you think ahead? You already have access to a bunch of data, I would imagine, but I'm curious to see what would improve that quality and what other types of streams would make it better.
Yeah, so first and foremost, because our system is an expert system upon which AI runs, it runs a little differently than like an open-ended AI system. So it's the example I use is kind of like mapping or navigation. So if you ask an AI system to find how do I get from here to there, and it doesn't know what the actual street layout is, it's going to come up with some kind of confusing and unclear answers. And so what we look at first is what is known in the peer review evidence-based literature between the associations of risks and diseases. And that forms the topology of the model. And so then the AI that is running can only run on top of that topology and make alterations to its recommendations based upon that. So it's kind of like navigation on a street map. So first and foremost, we're constantly looking at the literature and improving that model based upon new evidence-based studies that are coming out literally daily. And then second, we are running a variety of artificial intelligence and machine learning tools at site, at each one of the customer site, that is comparing what they're learning to the actual peer-reviewed literature. And so each time that does that, the model gets richer and specific to that particular individual site.
Interesting. Great. Well, we're going to take a break now from this and talk about now a slightly different lens on data analytics here. This is Kevin Click. He's the Vice President of Haystack Informatics. And this was spun out of Children's Hospital in Philadelphia, where you engineered an algorithm that can learn employee behavior using the EHR and its data. So today, your Haystack's health system clients use this intelligence to identify anomalous employee behavior and proactively monitor patient privacy as well. So it's a slightly different angle, similar sort of artificial intelligence and machine learning techniques. And so Kevin, let's get a sense of what you mean by tracking proactive patient privacy.
Thank you very much for the introduction. So about a year ago, my CEO came to me with a vision, and that was to take our understanding of what employees do in the role of patient privacy monitoring and help solve the variability problem within healthcare. What do I mean by that? So why is there so much variation within the patient experience within one health system? Why is there so much variation within the cost to deliver care and operations? So if you look at the screen, you'll see a heart. This is from our patient privacy monitoring solution. The heart represents a patient, and all the icons that surround that patient are the individual care team members. And what we know in privacy is each user's role, as well as the individual activities they perform to the patient. So what we wanted to do was identify how long does it take these employees to perform the individual tasks that they are doing. And that's how we got to a visualization such as this. And this is data's way of mirroring the patient experience, and what it reflects is the amount of wait time the patient endured, as well as the individual employee's time spent with the patient and potential bottleneck sources. So what we wanted to do is do this type of analysis of mirroring the patient experience, but for every single patient. And what we wanted that to reflect was the workflows of each individual employee and its impact on the productivity of the health system. So if you look at this health system here, for example, on the left you'll see a listing of locations. On the right-hand side you'll see a green marker, which represents above average performance. In red you'll see below average performance. And we can see here at Roxborough, they had the average visit length time for patients is above average, as well as inactive time. So I'm going to click into it, and for time's sake, I'll click in the primary care. And what you can see here is each individual's role within that primary care specialty at Roxborough. We can see how they're staffed, and the colored bar next to each role represents the individual average workflows of those employees within that role. And what's fantastic about the solution is it allows us to really drill down from here, any level, clinical, non-clinical role. So for example, if I really peel back the onion on registered nurses, it gives me the ability to really see each individual nurse's workflow. And as you can see, the system highlights Randy because Randy's seen the least amount of patients but spent the most time in the EHR. So clearly, Randy could be struggling potentially. And the system, at a very granular level, allows us to really see the patients that Randy saw and the individual activities that might be causing Randy to struggle in the EHR. And what's really exciting about this is that our understanding of what employees do and how long it takes them to perform the tasks that they do, all we really need to do is mix in some compensation data, and we can perform an automated version of time-driven activity-based costing across an entire health network. So as executives try and identify how do we deliver care at the lowest cost, we can take a treatment, for example, and we can compare all the locations that deliver that treatment within a health system and identify who's delivering it at the lowest cost from a staffing standpoint. So I'm going to end with this because I think I got about 18 seconds left. Our vision is similar to what Amazon does with learning consumer buying behavior. Amazon has perfected predicting what and when you're going to make your next purchase. What we want to do is learn employee behavior to a whole nother level so that we can actually predict what the patient's going to experience before they step into a health system. So, thank you.
Thank you.